Hello, my name is Liliana Ruiz. On this video, I will be reflecting on the case of Amy, which is a 20-year-old gymnast presenting with amenorrhea, cold intolerance, and restrictive eating behaviors. I will discuss her diagnosis, differential diagnosis, key clinical findings, and treatment recommendations. I'll also reflect on my own role and emotional responses as a future psychiatric mental health nurse practitioner, including ethical considerations in caring for clients with eating disorders. So first, we'll start with diagnosis and differential diagnosis. So based on Amy's presentation, specifically how low her caloric intake is, and the description of her body image distortion, amenorrhea, which is the absence of her period, and fear of gaining weight, the most likely diagnosis is anorexia nervosa, the restricting type, according to American Psychiatric Association 2022. So possible differential diagnosis include bulimia nervosa, as it shares features of body image distortion but involves binging and purging behaviors. The second is avoidant food intake disorders, where restriction occurs without body image disturbances. And 3 is hypothalamic amenorrhea, secondary to excessive exercise, which may coexist with restrictive eating patterns, which is shown in Amy's case. Typical symptoms and clinical findings in clients with anorexia nervosa often present with absence of period, amenorrhea, fatigue, constipation, cold intolerance, and bradycardia. Psychologically, they display an intense fear of gaining weight and a distorted image even when they are underweight. In text citation, Treasure ETAL 2021. Amy's symptoms include missing her periods, again, amenorrhea, low caloric intake, and she believes she is overweight even though she isn't. These are all hallmark signs and indicators of anorexia nervosa. Laboratory findings in people with anorexia nervosa usually manifest as hypokalemia, hyponatremia, hypoglycemia, elevated liver enzymes, and low thyroid hormone levels due to starvation. In severe cases, anemia also occurs, and leukopenia may be present. Again, low hemoglobin, low white blood count, RBCs. The variations found in a physical symptom often include a low body mass index, nuchal hair, which occurs due to cold intolerance, which causes the body to start growing small baby-like hairs, dry skin, brittle nails, bradycardia, and hypotension. Moretti ETAL 2023 in text citation. Management as a psychiatric nurse practitioner would include, but not limited to, one of the major challenges in treating anorexia nervosa is that clients often have they may have a limited insight into seeing what really is going on with them and how severe their condition is, and they may deny that weight loss is a problem. As a psychiatric nurse practitioner, my approach would be building a therapeutic alliance with the patient in order to build good rapport and demonstrate empathy in order to build trust and use non-judgmental communication. I would also employ motivational interviewing techniques to enhance readiness for change and emphasize the medical risks associated with malnutrition and anorexia nervosa. Collaboration with multidisciplinary team, including a dietitian, a primary care provider, and a therapist would also be essential in this case. In severe cases, hospitalization for nutrition stabilization may be required. In text citation, National Institute for Healthcare Excellence, 2020. Treatment recommendations. My treatment plan would include nutritional rehab with gradual caloric increases to restore healthy weight, which could include maintaining recording of the calorie intake that is being consumed by the patient. Also, using CBT, which is cognitive behavioral therapy, which has been shown to be effective for body image distortion and maladaptive beliefs about food. In text citation, Lina Nerdan, ETAL 2022. And family-based therapy, especially for young adults to engage family support and accountability would also be helpful in order to know that they are not alone and that they have a support system. And then close medical monitoring for cardiac complications and electrolyte imbalance, which is also seen in patients with anorexia nervosa due to the frequent fluctuations of electrolytes and its impact in cardiovascular system. Ethical reflection and self-awareness. In treating clients with eating disorders, it can be very emotionally challenging. I would say that in my role as a psychiatric nurse practitioner, I might feel a little frustrated or sadness seeing someone like Amy struggle with self-perception despite clear health risks. I would say that it would be very important to recognize these emotions as part of emotional intelligence and the ability to identify, understand, and manage both my own feelings and those of my client. Ethically, I must balance autonomy, which would be respecting Amy's right to make decisions, with beneficence on acting in her best interest when her judgment is impaired by her illness. Which again, as I mentioned, in anorexia nervosa, a lot of patients might not see their illness, that despite them being underweight, they might still be thinking that they are overweight. Veracity and honesty is equally important in discussing the health consequences of her behaviors. Maintaining empathy while setting firm boundaries ensures ethical and compassionate care in this case. In conclusion, Amy's case illustrates the complexity of managing anorexia nervosa and the importance of reflective practice as a psychiatric nurse practitioner. By maintaining self-awareness, emotional regulation, and a collaborative evidence-based approach, I can provide effective, ethical, and compassionate care for clients with eating disorders. Thank you so much for listening.